to ask a question, send it to us. But let's begin with one from Steve Burnett. Burnett, he asked this question, I guess, to all three of you. What NGOs and global faith organizations have been most valuable to each of you in your respective country in dealing with HIV and AIDS, but most especially COVID-19? What do you experience from other organizations? Gonna have to connect Dr. Sam and Bishop and so forth.
Thank you so much, John and Steve, for the question he has asked. As far as Kaga Synod is concerned, I have not benefited from any other organization in the country, especially on the area of COVID-19. The only organization that has is the one organization in Texas that has sent some money, but I have not been able to work or benefit from any other organization for these interventions.
In India, for example, most of the activities have been done through the government. However, we find that Oxfam and another American organization is also working. Save the Children are working. I mean, I see that on the television, that they are soliciting support and in the country. So, and I honestly, I don't know much about what exactly they are doing on the field.
For us here in Rwanda, the other organization, the government was dealing with the issue of just helping to see whether they can help the population who are just vulnerable. And then, but here around, there are the local NGOs, there are also international NGOs which were working or are working and contribute so as they can intervene and also help the population who are just suffering, but they are those who are not unreachable because of they are at a remote area. That's one. And the second one, you know, the target group of each organization, they can reach at this population, but they cannot reach the other population. That's why we have just some are being supported by different organizations and even government, but there are others who are not supported, but the government is still dealing with it.
Thank you for those responses. I believe that Claudia asked about the UN. I didn't hear anything about that, but I think we got some sense of what's happening. Carla Williams, who was a DU psychology student who spent time in Namakal, asked Dr. Sam this question. During my time in India, I learned it was often difficult for those positive with HIV to receive medical services in general. Dr. Sam, do you find people who are HIV positive and also infected with COVID-19 being turned away from hospitals more frequently than others?
It's nice to hear that question. I think the situation of HIV positive people going to a government hospital in the last 35 years has not changed. This is very sad. And as we see COVID increasing, the large number of people we are going to test, we are going to find a lot of new cases. Probably this would be the same fate of people who got COVID-19, because stigma is already set in for COVID-19. You know, we went through this issue of respiratory infection. Then we went into central nervous system infection, GI system. Now all the systems are involved. So the common man is now looking at COVID-19. How can I stigmatize this person? So people again, we see this from HIV/AIDS scenes before, are not coming forward and going to a hospital or being accepted by the medical people if they have COVID-19. So it's very sad, but there's a lot of work to be done for both these diseases once again.
Augustin, in Rwanda, one of the things you have experienced is a robbery in the inclusive salon that you started with LGBTQ persons and persons living with HIV. We're not sure whether that is related to kind of a hate crime or just part of a crime epidemic. We do have increased crime here in Denver during this time, according to reports. Do you want to say a brief word about what happened and that experience?
Thank you very much for the question and this concern about just the robbery, which you have known in the last week. It was just in noon, whereby just they come and they open. That we are thinking maybe they had a key of which they used to open, because they didn't just cut a padlock, they didn't cut a door, they didn't even dig a hole, but they opened by using a key, whereby we realized that at the end of the time, realized that the things have been stolen. But it was, I don't think that it is just related to the crime against our people, our LGBT people, and our HIV positive. I don't know whether it is related, but we still in research, we are checking whether it is related. And if it will be related, I will let you know. But nowadays, I cannot not conclude that it is just related. But because the population are suffering with hunger, with starvation, maybe they are even the robber who would like even to take those property, those materials, and sell them at cheap price, so as they can get even food or how to survive. That we are just thinking, and we have just already take the case into the local authority who deals with the issue, and they are just following and tracking whether they can catch those who have just those who have stolen the material. So we still in the track.
Thank you. A question to you, Dr. Sam, from Jay, saying how the sewing project's going in Coley Hills. I believe you've actually changed the focus a bit.
Yes, we started this project in January this year, and when Dawn and Chin and Brad and Dr. Burt had come there, and it moved so fast. Even I'm amazed at the way the project moved. And today we have, and I think that's because the funds came in quite fast, and we were able to, let me just get to what this project's objective is about. We find a lot of young mothers who are HIV positive, and the husbands are not at home. They are either gone as migratory workers somewhere, and these women are just staying at home, cooking food to the children, and then just staying at home and not doing anything. So we thought, why can't we teach them a skill? Why can't we teach them something? So this is how the sewing project started. And Dawn and Chin and Brad and Dr. Burt were so kind that they found the money to purchase the machines, and we have employed a person to teach them how to do it. And they're doing, I mean, honestly, I don't know much about stitching, but they're doing a fantastic job. And now they are stitching masks to be given to their neighbors and to schools and so on. So this is really going well.
Keep sending your chat questions, and I'll make a special appeal to Julie White, who sent a message, but we only got part of it. So Julie, send it again, please. Bishop Catherine, could you tell us a story of the grandmother you encountered on the first day?
Thank you, Don. This was on the day that we invited them for food. And this grandmother could not believe it because she had stayed for a number of days hungry, and she had no idea that food was going to come her way. She was desperate for food. She, her grandchildren and herself had slept hungry for a couple of days. So when they received this message from their community health workers that there will be food distribution, she was the very first person that arrived to receive the food. And she sat in front of the office waiting for the food to be distributed. And at that point, I found her seated and interceding. She was seriously praying and thanking God for whoever had sent for that food, because she said it was manna from God, because the next few days or the couple of days, she and her grandchildren were not going to be hungry. So she interceded for everyone, she cried, and it was a very passionate moment for the lady. So yes, that is what happened. And there are very many others actually who received that food and continue to pray for you people. And I believe those prayers are going to go quite far, because that is actually the work that God intends each Christian to be able to do. So yeah, that's what happened to that lady. And she continues to say lots of gratitude to you all.
A question from Julie White. Dr. Sam, have any healthcare workers in Namakal been experiencing aggression as they try to contact and trace infections?
Yes, this is becoming very common at the moment for people when they go to talk about HIV/AIDS. And also, some of our staff are looking around if they can find any patients who are at high risk for coronavirus, and they do face aggression. It is a very difficult situation. Unless the communities, unless the society continue to change. And this is where I like when you guys come from Denver to visit us, and when you touch our patients. You know, it is a fantastic experience when you touch them, you hug them, you pray with them. This is phenomenal. And I always liked, that they are not going to get infected because you're touching them or you're hugging them. And I really, it's one of the best things a mission which you spread when you come out to see us and our patients.
And that, of course, is the irony now, because we have to stay 6 feet apart from each other, much less touch or anyone. So we're in a new pandemic situation. India is facing cyclones right now, which is going to cause additional problems. Bishop Catherine, and we're going to start wrapping this up here. Would you like to say a final word? And likewise, I'll invite our other two guests.
Yeah, thank you so much, Don. Mine is to once again appreciate you for the effort, and also call upon all of us to seriously intercede. Those who can go before God and pray, we seriously need those prayers, because I don't know the direction things are going is very sad, and people need to continue to be fed. Right now, they are saying they don't even know when the children will go back to school. And therefore, I don't know whether at some point we shall also ask you to allow us to use their tuition money, but that will come if we exhaust the money that we already have. So I want to appreciate you and ask each one of us to seriously pray because things are not good. Thank you.
Thank you. Before I turn to Augustin, Sam, we have another question from you. For you, how are husbands responding to the women gaining their own sense of livelihood and sewing for their communities? How's that happening? What's the impact?
Yeah. You know, Don, this in India, actually, husbands don't like women becoming independent, you know, and this is cultural. This is, I think, it's difficult to change this, but they would still, the wives would earn the money and give it to the husband to spend it. I don't think it happens in US, but in India, it does still happen. And I think we have a long way to go in training and teaching of how God created men and women equally.
Augustin, do you want to share anything else that you may have not had a chance to say?
It is just to really appreciate this meeting and this sharing of work which have been done in different countries. And also, I would like also to tell you that here in Rwanda, we are struggling with the inclusive mission for health and hope, so as it can just become a non-organization, a non-government organization which can just work freely, which can also join and meet LGBT people, which can just even gather them and give them advice, counseling them, meet them, put them in stigma, and those who are just living with HIV/AIDS. So that is the struggle which we are just we have nowadays. And let us ask you a request to everybody to pray for us so as we can just reach far as possible we want. Thank you very much, and we really appreciate your contribution.
And Dr. Sam, is there anything you'd like to finish with saying?
John, it's just to once again thank you all for doing what you have done. You came at the right time. You were ahead of many others. And this is what we could help our patients, children, and women particularly. You know, if you didn't come at that right time, during this lockout period, they would have had a lot of difficulties. So you prevented this hunger from women and children and some men. Thank you very much. I hope you will continue to do this in different ways. And we thank you and your supporters. Thank you very much.
And thank you to all of you who are humanitarian heroes and sheroes, who are donating money, who are delivering the money, who are talking to your friends. We are grateful to have such a large audience here today to contribute. Our time is ended. We'll continue to work on this. The board of directors meets next week. We will be assessing what we've done and what we need to do for the future. I might tell you that we're going to have a virtual Swinging at AIDS golf tournament August 12th, and or it's August 14th. It's Wednesday, whatever date. And we're going to need all of your help and support on that, because we have the continuing programs for the Center for Health and Hope, which provide the basic structure for this COVID outreach. So I want to say to all of you that I appreciate your being here, particularly for our friends in Africa and India. I want you all to stay healthy, try to distance yourself, but still enjoy your friendships with everyone. Thank you, Pastor Nathan, Sam, Catherine, Bahati, all of you, and Chin for all your work. God bless you, and be healthy.